The Prime Minister hinting to more health measures being implemented. PAHO has discovered a coronavirus variant in the Bahamas, and President of the Bahamas Nurses Union says that nurses continue to be overwhelmed. Good evening, everyone. I'm Tyler Simonet with your JCN News for this Thursday, July 22nd. Prime Minister Dr. Hubert Minnis announces a national address this Sunday amidst a sudden spike in COVID cases. Dr. Minnis, during his speech at the opening of Margaritaville yesterday, stressed the need for the public to get vaccinated and abide by public health measures. He also alluded to a need for further safety measures, which, coinciding with his recent announcement of a press conference on Sunday, has many speculating that the Prime Minister plans to enact new public restrictions. In his speech, the PM specifically mentioned plans to discuss public health measures and vaccines in the coming days, while also singling out New Providence.
To restore our economy and our country, more Bahamians must be vaccinated. In the coming days, I will have more to say about our public health measures and vaccines in response to the increase in cases, mostly here in New Providence. I once again implore everyone to abide by the public health measures.
This comes as 95 new cases of COVID-19 were confirmed in the country on Tuesday, with 77 of them in Nassau, 7 on Grand Bahama, 4 on Exuma and Eleuthera, 2 on Bimini and Cat-Key, and 1 on Abaco. As of Tuesday, there are 1,264 active cases. The Pan American Health Organization confirming that the Alpha variant of the coronavirus has been detected in the Bahamas. During its weekly press briefing on COVID-19, PAHO's regional advisor for viral and emerging diseases, Dr. Jairo Andres Mendez Rico, was fielding questions about whether the organization had confirmed additional variants in the Bahamas since the onset of the pandemic. Dr. Mendez Rico had this response.
In close collaboration with the Genomic Surveillance Regional Network, several samples from the Bahamas have been sent to the Sequencing Reference Lab in Fiocruz, Rio de Janeiro, in Brazil, where actually complete genomes have been obtained. According to the most recent information, to be officially verified by the country but already available in global databases, the Alpha variant of concern has been detected in most of the samples, together with other variants in less proportion, including the Iota, which has been classified by WHO as a variant of interest. So far, there is no evidence of Delta variant circulation in the Bahamas. Nevertheless, the genomic surveillance should be maintained to timely detect the possible introduction and spread of Delta or any other variant.
While health officials here in country have speculated the presence of variants in country, none have publicly confirmed based on samples sent to labs. The Alpha variant is estimated to be between 40% and 80% more transmissible than the original. So far, the Alpha, Beta, Delta, and Gamma strains are considered the variants of concern due to an increase in transmissibility, increased hospitalization or death, and reduced effectiveness of treatments or vaccines. The country is in its fourth wave of the COVID-19 pandemic based on the COVID-19 numbers. Well, at least that's how President of the Bahamas Nurses Union, Amancia Williams, sees it. Nurse Williams kept it frank in an interview with JCN's news team this morning, while also confirming that there are several nurses out sick due to COVID-19. The head of the Nurses Union says nurses are overwhelmed.
You know, we have a number of COVID cases that are coming in. And A is the entry point for admission into the hospital. So we're very overwhelmed, and we're saying to the public, please, you're vaccinated does not mean that you will not contract COVID. So you still need to exercise precaution, and we're still in a pandemic.
Since July 17th, the Ministry of Health recorded a total of 314 new infections in 4 days. That along with 92 hospitalized cases. Asked if tighter COVID-19 restrictions should be reintroduced, Nurse Williams says this.
Take precautions. You understand? You have to do what you have to do to safeguard the lives of the people. So you have to do what you have to do. So you have to, if you see that the numbers are going up in Bimini, the numbers are going up in Freeport, then you say to that area is obviously we're losing some control. Okay? But you have to do what you have to do.
The BNU chief stressing that the public should be wise during this time and continue educating themselves because we're not out of the woods just yet. The Bahamas has received 3,496 doses of the COVID-19 AstraZeneca vaccine as a result of a donation from the British Overseas Territories of Montserrat and Anguilla, with the assistance of United Kingdom High Commissioner Sarah Dixon. Dr. Mercelin Dalregis, chair of the National COVID-19 Vaccine Consultative Committee and Special Health Advisor to the Prime Minister, says the vaccines are a welcomed addition to the country's current vaccine supplies and will be used to continue the administration of second doses. The vaccines were received yesterday at the Lilimpinding International Airport. Dr. Dalregis also thanked the Pan American Health Organization for helping to coordinate the effort. The Princess Margaret Hospital is making an urgent appeal for the public to make arrangements directly or via legal representatives for the collection of their deceased loved ones from the hospital's morgue. In a statement issued by the Public Hospitals Authority, it says this appeal comes as the morgue is operating beyond capacity. The PHA is also requesting funeral homes who are under contract by deceased families to accelerate the removal of bodies in preparation for burial. In the event where bodies are not removed in a timely manner, the PHA will have no alternative but to seek the required legal authority to remove the remains. While PMH attempts to mitigate its limited storage capacity, it says the increasing number of bodies threatens morgue operations, as overflow conditions can compromise the integrity of bodies over time. Persons can contact the hospital at telephone number 322-2861. You're watching JCN News. Stay with us.